Rooming a Patient 101. If you have been to the doctor for an illness or a regular checkup, you have been roomed. Pay attention to the slides that you will see if you have had a similar experience, or think about what may be missing from your experience. Difficult patients. The video that I am going to show shows you a little bit of an example of what a medical assistant may encounter and how you can handle the situation in a professional manner. So you'll notice in that video that the patient was really upset due to a wait time. And as the medical assistant entered the room, you'll see that she continued to keep eye contact, and she continued to speak to the patient and really give her undivided attention. And then as we go through here, she also got down to the patient's level. So she didn't continue to stand, she took a seat and really got on the same level as the patient. And that can help alleviate some of the patient's worries or concerns, and even their anger in times where they're not feeling the best. On our next slide here is our thesis statement. So the following slides that I will cover, the three main parts are: a medical assistant is responsible for during a typical clinic visit, which are the patient interview, taking vital signs, and the orders that need to be completed after the doctor has seen the patient. Sometimes, depending on what the patient is being seen for, the orders and the vitals may vary from appointment to appointment. So I will be going over almost everything a medical assistant will do during the rooming process. But as a patient yourself, I want you to be sure to not assume that all of these things need to happen depending on what you're being seen for. Medical assisting, a brief history. So established in 1956, the American Association of Medical Assistants continues to be the only association devoted exclusively to the medical assistant profession. So they are the only organization that is devoted fully to the medical assistant, and that's going to be for any certifications or ongoing legal issues that an MA might encounter during their career. In 1974, the U.S. Office of Education recognized AMA and AAMA as an official accrediting agency for medical assisting programs in public and private institutions. And here at MBC, our MA program is accredited by AAMA. Rooming a patient. The first step in the exam process is the patient interview. This is a well-conducted initial interview in the exam room to help prepare information for the provider. Once you've gathered the information for the provider, you can make sure it is concise and clear. Keep your patient updated with how long a wait time may be. Yay or nay, things to do or not do while rooming a patient. Definitely do. You want to maintain patient confidentiality, so that's going to be checking name and date of birth and asking any confidential or any questions relating to their health care in a private area. Ask open-ended questions to your patients. Restate patient responses to ensure that you have collected the correct information, and maintain eye contact with your patient. Things to not do. Do not talk about patient information with anyone other than people directly involved with their care. So if you encounter a patient and they have an interesting thing or an interesting issue or maybe a disease that you've never encountered before, it is absolutely not okay for you to leave that exam room and discuss it with anybody else other than the doctor that's taking care of the patient. And if you, as the patient, ever overhear somebody discussing your care and that somebody is not directly related to your care, you definitely need to file a formal complaint. Do not room someone without verifying their name and date of birth. It may be annoying as a patient to continuously be asked, what is your name, date of birth, because you feel as if they should know who you are, but they are doing that to ensure that they're in the right patient chart and that they have the right person. Do not look directly at the computer or sheet of paper while you ask questions. One of the downfalls of the invention of the internet or computers is a loss of true patient contact. Do not rush through the interview process. Even though you're busy and you may have plenty of other patients to take care of, or your doctor needs something, the patient that you're currently with needs your undivided attention. And you need to take your time so you make sure that you don't miss anything that's important. And do not bring your personal issues to work, which can be difficult at times. But just remember to keep anything that's going on at home out of the workplace. And that'll be true for anybody. First part is the patient interview. The patient interview is a series of questions that you are asked when you're brought back to the private room. It is important to wait until you are in the private room to maintain patient confidentiality. The patient interview, these are a series of questions that are asked depending on why you're there. It can vary from, can I verify your name and date of birth? What brings you to the doctor's office today? How long have you been experiencing any symptoms? Any pain today? What medications are you currently taking? Are you allergic to any medications? What pharmacy would you like to use today if you're prescribed a medication? And is there anything else you want the doctor to know today? And then they normally thank you and let you know that the doctor will be in soon. It's always a nice gesture when you're able to let the patient know an estimated wait time. With patients, that's almost always the number one concern, is how long is this going to take? They are busy, as are you. And completing the interview before vitals can allow the patient to relax and get settled before you take blood pressure and so on. Our next assignment here in a series of things that an MA will do during a rooming process are the vital signs. Weight and height can be taken prior to arriving to the exam room and before the patient interview. Weight is usually the first vital sign that you will obtain. It is important so the doctor can make sure there has not been any sudden weight loss or weight gain. It is also necessary to know a patient's current weight, so if prescribed medication, they can give you the correct dose. And then we've got height, which is usually taken only at a physical exam, unless the doctor asks you to do so. Blood pressure is a very important vital that can be a telling sign that you are healthy or something is wrong. Then you've got temperature that will be taken, typically if the patient is complaining about any type of illness. Respirations are taken to see how many breaths you're taking within 1 minute. Pulse, also how many beats per minute your heart is going. And all the vital signs that are listed here may not happen at every doctor's appointment. What you are being seen for will dictate what vital signs your MA completes. So after the vital signs, the doctor will typically come in and do their full assessment, their exam, ask their series of questions. And from there, they'll leave the exam room, go out and do a final analysis of all the information they've received, and then they'll decide what needs to happen after that. Sometimes it can be a simple discharge and you'll be on your way. Other times there will be tests that need to be completed. And here's where patient orders come into play. So patient orders can vary from a strep test, which is a throat swab that you'll see here in the picture, injections, blood draws, capillary punctures, which will be a finger stick, dressing applications if you are seen for an injury, casting if you have a fracture, splints if you have a sprain. It can also be collection of urine, collection of stool, an EKG, any thermotherapy or cryotherapy, which is just hot and cold therapies. It might be a simple referral for additional care. Could also be a preoperative instructions if you're going to be having a surgery in the upcoming future. Your MA might be going over that information with you as well. And sutures or staple removal if you have had a surgery or been had an injury in the past. In conclusion, when you visit the doctor's office, it should feel like a welcoming place. There will be times when the clinic is busy and running behind. When the clinic is busy, you should still feel as though you are important. So if you notice that your medical assistant is rushing through it or your doctor is not giving you their undivided attention, please speak up. And if you notice that there is something wrong or you feel that there should be questions asked that weren't, please speak up. The more information the MA or the doctor has, the better they will be able to help you. And if you have concerns, please reach out by survey or ask to speak to the clinic manager. It is your right to have the very best care. Now you should have a clear picture of what an MA is responsible for. Rooming a patient involves the patient interview, vital signs, and completing orders if there are any. Any questions? And here is my bibliography. Thank you.